Welcome to the deep dive. Today, we're cutting through some of the noise around supplements. We're focusing on one molecule, arginine, that acts like this powerful hidden key for your circulatory system.
Yeah, it's a really interesting one.
You've probably seen it listed, in pre-workouts or anti-aging formulas. But we want to go deeper,
Right?
explore its big impact on cardiovascular health. But here's the twist, the thing most people miss. Its supply chain starts right in your gut.
Exactly. If you miss that link, you miss, well, kind of the whole picture.
So that's our goal today.
That's the core mission, yeah. Arginine, it's an amino acid. We need to understand its complex status, sometimes essential, sometimes not,
Right.
and really detail the evidence for its benefits, circulation, recovery, based on the sources we've looked at.
Okay, so let's start with why it's such a big deal. Arginine is the direct precursor to nitric oxide, NO.
Nitric oxide, yeah. A gas molecule, believe it or not.
And it acts as this incredibly important signaling agent. I mean, the discovery was so fundamental, the researcher won a Nobel Prize for it back in, 98?
That's right, 1998. It tells you this isn't just a fad, it's basic biology.
Foundational stuff.
Absolutely foundational. So, to start, arginine is usually called a semi-essential amino acid.
Okay, semi-essential, we usually hear essential, gotta eat it, or non-essential, body makes it. Let's unpack semi. What makes it conditional?
Well, your body can make it, technically, under ideal conditions, but that ability isn't always reliable.
Wow.
It becomes strictly essential, meaning you must get it from outside during specific times. Childhood, obviously, growth demands are huge.
Makes sense.
And then later in life, usually we say around 60, 65 plus, the body's own production it slows down, declines with age.
So periods of high demand or low production, we need external help.
Correct. And it's also triggered by severe stress, think major illness, trauma, or, and this is critical, chronic intestinal inflammation. If you've got those issues, your internal supply just can't keep up. Demand outstrips supply completely.
Okay, let's talk about that supply chain then. Where do we typically get it from food?
Key sources are things like red meat, dairy products, and marine products, especially shellfish, crustaceans, things like that.
And like we said, it's common in supplements, pre-workouts, anti-aging blend.
Oh, yeah, very common. But let's trace that internal production path you mentioned earlier. If the body is making it, how does that actually work?
Right, the pathway.
This is the absolute critical link. Arginine is synthesized inside your body from something called citrulline malate.
Okay.
But citrulline malate itself is made from glutamine. And this whole initial step, the glutamine to citrulline part, it happens in the gut, in the intestinal environment.
Whoa, okay. So glutamine in the gut. That's the starting block for arginine.
Exactly. Yeah. That's why the gut connection is so huge. If you have any kind of gut problem, leaky gut, chronic inflammation, food allergies, gastritis, even infections like H. pylori or candida,
Right.
your ability to convert that glutamine gets messed up. It compromises the whole production line.
So you could be like otherwise healthy, but low on arginine just because your gut isn't working right.
Precisely. Supplementing them becomes a way to bypass that broken factory, basically. Get the arginine directly because your gut can't start the process properly.
That really reframes how you think about it. It's not just about swallowing a pill.
Not at all.
Okay, let's zoom back out then. Assuming the supply is okay, either from diet, synthesis, or supplements, let's hit arginine's main claim to fame, vasodilation. What's that mean for our heart and arteries?
So arginine makes nitric oxide, and NO signals the smooth muscles in your artery walls to relax. It's a potent arterial vasodilator.
Widens the pipes, essentially.
Exactly, widens the pipes. And this effect is incredibly useful across a whole range of circulatory issues.
People often talk about it for blood pressure. Is it just for borderline cases, or can it actually, compete with meds?
The sources suggest it's quite effective for that borderline hypertension. If your pressure is just creeping up like 130 over 85 or 140 over 90, arginine supplementation might provide enough vasodilation to bring it back into a healthier range, maybe avoiding medication.
And if someone's already on blood pressure drugs?
It can be used alongside them, but, and this is really important, you absolutely have to talk to your doctor.
Right.
Because the goal there might be to improve things enough that the doctor can actually lower the medication dose over time. Never adjust meds on your own.
Got it. What about the arteries themselves? Long-term health?
Yeah, it helps with systemic vascular stuff. It's shown benefits for arteriosclerosis hardening of the arteries,
Hmm.
helps manage cholesterol profiles like high LDL, high triglycerides, low HDL, and by improving blood flow and making blood a bit less sticky, less prone to clotting.
Especially if you have high hematocrit, maybe?
Exactly. It reduces the risk of serious events like heart attacks, strokes, blood clots. It's supporting the vessel lining, the elasticity.
Okay, let's make this concrete. Think about intermittent claudication. I know this hits a lot of people, maybe 55, 60 plus,
Mhm.
especially smokers or diabetics.
Oh, absolutely. It's a classic, really frustrating symptom.
Describe it for us.
It's that severe leg pain, sometimes cramping, sometimes burning, that kicks in after walking just a short distance, maybe 100 meters, 150
And
meters.
you have to stop.
You're forced to stop, rest, wait for the pain to subside. It really impacts mobility, quality of life.
And that pain is basically the leg muscles screaming for oxygen because the narrowed arteries can't deliver enough blood when they're working.
Precisely. And arginine hits this head on, that vasodilation effect. It forces more oxygen-rich blood down into those working leg muscles,
Alleviating the pain.
alleviating that debilitating pain. I mean, I've seen cases where it dramatically helps people just, walk normally again, walk the dog, go grocery shopping without that constant stopping. It's a big deal for them.
Wow. Okay, so powerful circulatory effects. Moving beyond the heart and main arteries. What about recovery? High demand situations like surgery.
Yeah, this follows the same logic. Vasodilation equals better delivery. So after surgery, it could be orthopedic, intestinal, even cosmetic surgery.
Hmm.
Arginine helps speed up tissue repair. Better blood flow means faster delivery of everything needed for healing. Red blood cells for oxygen, white cells and lymphocytes to fight infection and manage inflammation, platelets for clotting.
So it speeds up the whole process.
It speeds it up and reduces post-op inflammation. We often recommend starting it maybe a week before a planned surgery and continuing for 2 or 3 weeks after.
Interesting. Now, for something maybe unexpected, migraines.
Hmm.
Severe ones, the kind that really knock you out. How could a vasodilator help there?
Yeah, it seems counterintuitive sometimes, but the sources suggest it can be helpful. The idea is usually to combine it maybe 5 to 10 grams a day with other things known to help circulation or inflammation like vitamin C, maybe some caffeine, ginkgo biloba. Yeah. The overall improvement in cerebral circulation seems to be beneficial, and there's a specific note about it being particularly helpful for women who get those awful migraines tied to their cycle.
Oh, the premenstrual ones, like
Right.
around day 20, 21.
Exactly, those hormonally triggered ones. Arginine seems to offer some relief there for some women.
Fascinating. Okay, we can't talk vasodilation without bringing up
Hmm.
sexual health, specifically erectile dysfunction.
Right. And arginine has a pretty significant history here. Before sildenafil Viagra came along in the 90s,
Yeah.
arginine was basically the main natural product used for ED. The mechanism is straightforward. Better vasodilation means better blood flow into the cavernous muscles of the penis,
Which you need for an erection.
which is essential for achieving and maintaining a viable erection. More blood flow, better function.
What kind of dose are we talking for ED support?
It's generally higher for this purpose, often in the range of 10 to 15 grams per day.
Okay.
And sometimes it's combined with other natural compounds like epimedium, often called horny goatweed. Epimedium actually works in a way that's somewhat similar to Viagra, inhibiting an enzyme called phosphodiesterase, so they can work well together.
Good to know. Finally, let's circle back to where many people first encounter arginine. The gym. Pre-workouts. Why is it such a staple for athletes?
Athletes talk about the pump.
Yeah, that feeling of muscle fullness.
Right. But it's not just cosmetic. That pump is a direct result of vasodilation. It means improved delivery of everything muscles need during hard work, oxygen, glucose.
Other supplements they might be taking, like creatine?
Exactly.
Hmm.
Creatine, beta-alanine, other nutrients get delivered more efficiently. This works for both aerobic and anaerobic exercise. Better performance during, and then critically, better nutrient uptake after the workout.
Maximizing recovery and growth.
Precisely. Better delivery means better building blocks getting to the muscle right when it needs them.
Okay, let's get down to brass tacks then, dosage and timing. For general use, you mentioned 5 to 10 grams.
Yes, 5 to 10 grams is a standard range for most applications we've discussed.
And when's the best time to take it? You mentioned pre-workout for athletes.
Right. For athletic performance, maybe 5-10 minutes before training, or immediately post-workout to help with that recovery nutrient delivery.
But what about for the cardiovascular benefits? Or for the ED support?
For those, the optimal timing is actually before going to sleep.
At night? That seems odd. Why not during the day when you're active?
There's a really important reason, biologically speaking. Statistically, most major cardiovascular events, heart attacks, strokes, they tend to happen in the very early morning hours.
Like 3 or 4 a.m.?
Exactly, around then. Taking arginine before bed ensures its levels are higher, maximizing that protective vasodilating effect during that peak risk window.
Wow. Okay. That makes sense.
And for ED, taking it at night aligns with the body's natural testosterone peak, which also happens in the early morning.
Right.
And it supports the nitric oxide production needed for those natural morning erections that often occur between, say, 4 and 7 a.m.
That timing logic is really quite specific and important.
It is. Timing can really influence effectiveness for certain goals.
Okay, let's address the elephant in the room. The myth that taking arginine powder is a great way to boost growth hormone. You hear this all the time.
Yes, this one persists. And look, it's based on a kernel of truth, which makes it confusing. Arginine is a growth hormone secretagogue.
Meaning it makes your pituitary gland release GH.
Correct. This is proven, no question, but
Right.
it's only proven when given in very high doses intravenously, like in a hospital setting through an IV drip.
Okay, so what happens when you just drink it?
To get the same blood concentration of arginine orally that you get from those IV studies, you'd have to swallow an absolutely enormous, impossible amount of powder.
Like how much?
We're talking like half a kilogram or something ridiculous. It's just not feasible or safe.
So the doses you take in a supplement?
They won't even register in terms of triggering a significant GH peak. Taking oral arginine for GH release is, frankly, useless. A waste of money if that's your only reason for taking it.
Good to clarify that. Finally, and this is crucial, safety. When should someone absolutely not take arginine or be very careful?
Okay, first, major caution. Low blood pressure, hypotension.
Right.
If you naturally have very low blood pressure, maybe you're quite slender. Pressure runs 100 over 60, 110 over 70, that kind of range.
Yeah.
Arginine's strong vasodilation can push that too low. It can cause dizziness, lightheadedness, even fainting, especially if you take it before exercise.
So know your numbers. And what about with blood pressure meds?
We mentioned consulting your doctor, but it bears repeating. If you're on antihypertensives, monitor your blood pressure closely when adding arginine. It might potentiate the effect of your medication, meaning your dose might need adjustment downwards by your doctor.
Crucial point. And the last, really critical warning.
Okay, if you are prone to herpes outbreaks, cold sores on the lips, genital herpes, shingles even, listen very carefully.
Whoa.
The herpes simplex virus needs arginine to replicate. It basically uses it as fuel to multiply. We see this clinically quite often. People prone to outbreaks start taking arginine, maybe for workout reasons, and boom, they get an outbreak, sometimes quite severe.
So it can actually trigger an outbreak.
It absolutely can. So if you know you're susceptible to herpes viruses, you should be extremely cautious with arginine or probably avoid it altogether.
Are there alternatives for NO boosting if you have that issue?
Yes, citrulline, which we mentioned earlier as the precursor, is often a better choice in that case, as it doesn't seem to carry the same herpes risk but still boosts NO levels.
That is a really vital safety point. Okay, so arginine, clearly a very powerful, multifaceted molecule. Benefits for circulation, immunity via recovery, sexual health, athletic performance.
Definitely.
Generally safe if you follow the guidelines and pay attention to those contraindications.
Exactly. And if we just tie this back to the very beginning, that bigger picture.
Gut connection.
The gut connection. It really highlights how interconnected everything is. Your body's ability to even make this crucial molecule depends entirely on the health of your gut environment to process that initial glutamine.
It always comes back to the foundations, doesn't it?
Right.
Gut health impacting everything.
Fundamentally.
Which leaves us with a thought for you, the listener. Considering how much arginine synthesis relies on a healthy gut, what other essential molecules might your body be struggling to create properly when your intestinal system is inflamed or out of balance? Something to think about.
Definitely something to consider.
We'll leave you with that until our next deep dive.